You talked about adapters. There's the confusion about when to put the adapter on, when to take the adapter off. Depending on what type of adapter we're talking about, we can clarify that in a moment. But in general, I think as long as a device can be autoclaved, I think the biggest concern, which you're probably already aware of, is water quality, number one. And then it comes down to what type of residue you might see after so many cycles in an autoclave.
Rising above the buzz of ultrasonic cleaners and the clanking of stainless steel are the ideas and voices that are changing an industry. You're listening to the Beyond Clean podcast, the central nexus for the people, processes, and products that are improving our sterile processing world. Each week, we speak with frontline technicians, CEOs, engineers, and entrepreneurs with a common goal: to help you fight dirty, every instrument, every time. Whether you're tuning in for education or inspiration, we're glad you did. Now turn on those washers and turn up the volume. It's time to go beyond clean.
All right, Sterile Processing Universe, you're listening to Beyond Clean, Season 32, SPD Fact Check. I'm your host, Bobby Parker, and joining me in studio as our co-host for the season is Jamie Amaya. Jamie, welcome back to the studio.
Thank you. It's always a pleasure. Love it.
Like, what do you say at this point in the episode? I feel like we're just kind of like welcoming each other back into our own house, But
exactly. Hey, you know what?
It is good
fun,
to chat
so
with
it doesn't
you.
matter.
Yeah. One of the things that I've appreciated about having you as the co-host this season, Jamie, is that you're, living some of these challenges in real time. And so, yeah, I'm looking forward to this conversation in particular. And I'm curious kind of what your experience has been with it. As we've been talking about knowledge gaps, we wanted to have one episode to talk about some complex devices. And so we're going to talk about rigid endoscopes today and how the things get sterilized and all the bits and bobs that go along with it, from attachments to immediate use sterilization and everything in between. Like, how do you get these devices sterile and kind of navigate a complex web of decisions? So I'm looking forward to hearing how you've also had to navigate those very things in your department.
Oh yeah, it's definitely it's always a learning curve, right? And making sure that you do everything correct for that safe patient care. But this is going to be a good one. It's definitely going to be a good one.
Well, we've got the right guy to ask. We're going to be bringing in a clinical educator from a scope manufacturer to talk to us about how these things are made and help us dig into the data a little bit about how they ought to be sterilized. So stick with us. We'll be right back after a short break with Kurt Audette.
From the studios of Healthcare HQ, you're listening to Beyond Clean, the global voice of sterile processing.
And joining us now in studio is Kurt Audette, clinical specialist at KARL STORZ, longtime friend of Beyond Clean, and just an all-around nice guy. If you haven't gotten the chance to talk with Kurt, it's good to see you in studio again. Welcome back to the show.
It's great to be here again, and I'm looking forward to the conversation today with you and Jamie.
We always like to give folks an opportunity to learn a little bit about the guests that we're talking to, and we've puffed you up a little bit here in the introduction, but I want to give you an opportunity to tell us a little bit about yourself and what you've been doing in your career.
Yeah, I've been in the medical industry or the field for more than 35 years now, and my passion is just education. I have a background in electronics, a background in reprocessing and some other things, but, I've had a really good opportunity to work in that time frame with a lot of different folks across North America, including Canada, trying to help folks understand how they can use our products correctly, how they can reprocess them correctly to increase, the performance. And if I can help mentor some folks, I'm game for that too. So yeah, definitely looking forward to this.
Yeah. Well, you know, we mentioned longtime friend and just a really nice guy, Kurt. We got connected through some webinars that we did on Beyond Clean, and that willingness to help and just kind of, just cheerful educating, trying to help everybody do their job better definitely comes through in every conversation that we've had. So yeah, excited to get you back on the show here to talk through some more about rigid scopes and sterile processing. The season that we're working through, we're calling SPD Fact Check, and are trying to uncover some of the misconceptions or maybe just, curious things that you didn't know in sterile processing. And we're going to be looking at endoscopes and how they get sterilized, because there's just been a lot of questions that I've had around that topic that I want to get to. But before we get to that endoscope sterilization conversation, I wanted to start by just talking about rigid scopes in general. We've got a very broad swath of people who tune into the show, and this may be the first conversation about rigid endoscopes somebody's had. So why don't you start us right there? Tell us a little bit about what a rigid endoscope is and particularly how the thing is put together.
Yeah, great one. So endoscopes have been around for, since the 1800s. We've introduced what's called the rigid endoscope, rigid telescope. There are a lot of different names that folks use, but think of it as an instrument that gives us a microscopic look or minimally invasive look into clinical anatomy, whether there's an orifice that we can enter through or one that we need to create. So different manufacturers, obviously I work for one, but different manufacturers have come up with different types of endoscopes. So some that have viewing in standard white light, some that have viewing in what we're looking towards in the future, multifluorescent technology. That's another conversation. But all of these endoscopes share one thing in common. They all have glass that's carrying light and elements of color, so that the physician can actually view that clinical anatomy. Apart from that, each manufacturer has their own process to develop something that I like to call the prescription of a telescope. It's very similar to glasses that folks wear that don't have perfect eyesight. So within a rigid endoscope, we have what's called a rod lens train that has multiple segments individually separated by what's called spacers, and then some other different types of lensing that I won't go into too far because there are some differences there amongst manufacturers. Along those lines, with these rod lenses, we developed that prescription that the end result is determining the angle of view. So if I'm holding a telescope a certain way, am I looking at 30 degrees above, below, or 45, and different angles? Again, there's something called the field of view. So if I'm looking through the windshield of my car, I have a specific field of view. So scopes, different types of scopes are intended for different applications, clinical applications. So the view might be narrower in a sinus procedure than it might be in a laparoscopic bariatric. There are also things like working distance. So how close can we get to the anatomy? But these all go back to the prescription of the telescope.
Right. And how the thing is made. So if for the folks who are listening to this and, your introduction to rigid endoscopes so far has just been looking at one in the department and you haven't seen the inside of one of those and your eyes kind of just crossed a little bit, your homework for the day is just to go to Google and type in, rod lenses and take a look at what it looks like, or rigid endoscope anatomy, and see one kind of diagram blown out. One of my favorite learning opportunities as a sterile processing technician and even as a manager, we had a KARL STORZ regional educator who would come into our facility and he'd bring this board with him of just an exploded rigid endoscope. Kurt, you're nodding like I've seen that board before, right? So yeah, you've got one right behind you. Okay. So yeah, Mike Acton, if you're out there listening to this, like your in-services made an impact on me.
That's great.
But yeah, just being able to pass that around the room and see all the delicate components inside what this otherwise looks like a pretty durable, rigid metal thing, like has all these very small components inside of it, glass components, and you get a feel for how the thing is assembled. So anyway, if you haven't seen one of those, definitely go to Google, maybe call your local endoscope rep and ask them if they can bring something like that and show everybody, because it made an impact on me and kind of my reprocessing. So, Kurt, thanks for that introduction to rigid endoscopes, and hopefully that'll send some people down the right direction to get a handle on it. The knowledge gap in particular that we're wanting to talk through today, though, has to do with sterilization. And it's always been one of the great SPD mysteries to me that you have these rigid endoscopes that all kind of have the same appearance. You know, they have similar construction.
Yeah.
Some of them, you read the IFUs, say that they've got to only be low-temp sterilization, typically going in our hydrogen peroxide sterilizers. But then there's a handful of them, you know, particularly like the smaller ones, like our arthroscopes, for whatever reason at the facility I was at, could go in the steam sterilizer.
Yeah.
And that always mystified me. So I guess the question is, what gives, Kurt? Like, why is there so much variation on how these things get sterilized?
Yeah, that's another great question. That's why, you know, folks like me and Jamie have conversations routinely.
Yes.
What is this? How do I reprocess it? And then what can I put it in? You know, at the end of the day, when we're talking about rigid endoscopes and we're talking about a process like autoclaving, which involves, I think most of your audience is aware, involves high temp with some pressure. Now, with that said, glass typically does not like high temperature fluctuations. And, you know, we can get to that later, but there are critical components that are housed within, I'm not going to say all manufacturers, but I can speak to a couple that use something called an expansion spring. This expansion spring allows that rod lens train to actually expand and contract inside of an autoclave. You know, when it's pressurized, when it sees that type of heat. I'm sure there are other ways that manufacturers manage that expansion and contraction of the optics, but that is one integral part of a rigid endoscope to allow it to be autoclaved. Now, you mentioned an arthroscope. There are other types of endoscopes, not flexible, but endoscopes like semi-rigids that have an image bundle. And that's a little bit different type of glass. So there's another reason why it possibly could be autoclaved versus not autoclaved.
So with that being said, you know, because I'm not going to lie, I'm going to sit here and look at my practices, right? And then we go to our reps and double check IFUs. But even if steam is the validation, or both, let's say, then what's the plus and minus of doing either or, right? Because I know in an IFU for some of these scopes, it can say it can do both. And then I'm going to give you one a little bit further is why the adapters on versus not, right? Because there are some manufacturers where adapters stay on, adapters stay off. But what is it? Do we steam sterilize or do we low temp? And what's our best practice? I mean, of course, to follow an IFU, but why do you have to make it so difficult?
No. It's the question, believe it or not, I receive more often than not. You know, and I think about it this way, Jamie. This is a personal opinion now. Two perspectives. Number one, always the patient first. And I think you would agree.
Yes.
Number two, how am I going to extend the life of my product in some type of chemistry? So when I think of autoclave versus any low temperature, let's just say any other type of chemistry other than autoclave, then we start to go down the path of what's the percentage of chemistry, what type of chemistry is it, you know, all those different things. You talked about adapters. You know, there's the confusion about when to put the adapter on, when to take the adapter off, depending on what type of adapter we're talking about. We can clarify that in a moment. But in general, I think as long as a device can be autoclaved, I think the biggest concern, which you're probably already aware of, is water quality, number one. And then it comes down to what type of residue you might see after so many cycles in an autoclave. And I'll stop there.
Wait, don't stop now. You were getting to the juicy parts.
So
Come on.
I'll get you to go. So, you know, for me, the concern with autoclave is whatever residue is left behind on either the proximal or the distal lenses. And There are different manufacturers who have different techniques to remove those deposits, and there are different manufacturers with different recommendations on how often you should. Obviously, we should be doing a visual inspection after every single reprocessing cycle, but let's assume it's after 20 uses in an autoclave or after 50. What's our next steps? Because we're going to see those deposits. I don't think that's a secret. Maybe it is a secret to some, because I recently had a question. I won't say where from, but I recently had a customer who said, we're doing everything right. And they were. It was spot on. The process spot on. However, they were seeing this residual deposits, I'll call them. It was not biofilm or film, burden, sorry. This was definitely residue from water. And their water quality was good. It's just the nature of autoclave. If we're talking about other types of chemistries, it could be, if we're talking about Low-Temp now, I don't want to go into specific names and brands and start calling folks out, but if we don't do things correctly, obviously we're going to see a chemistry residue instead of just a liquid residue without a chemistry.
Yeah. Okay.
When just thinking about, so you mentioned patient safety and device longevity as kind of two priorities to think about as you're picking a sterilization method. Patient safety, I would imagine, comes back to just, follow the IFU. Like, let's make sure we're doing the right thing for patients. But that instrument longevity question is an interesting one. And I hadn't thought about clouding lenses and water quality deposits from steam. Is there any data out there or any just kind of personal experience about like how to make the instrument longevity decision? Like, are there some methods that are generally better for rigid endoscopes than others, just in terms of the thing not breaking down long term?
Generally speaking, yes. And I definitely want to be careful with this conversation. You can actually Google the term oxidative and fixative chemistry. Typically, fixative chemistries will extend I don't know if extend is the right word, but you will see a better life cycle with fixative chemistries than you would with an oxidative chemistry.
Gotcha. And just in terms of steam sterilization, does the higher temperature and the higher pressure wear out a device faster? Because that's just the impression that we might get in sterile processing is, there aren't as many endoscopes that can handle the steam sterilizer as the Low-Temp one. And so if I have both in front of me and I'm trying to prioritize one or the other, I might prioritize Low-Temp just to have my device last longer. Is that backwards thinking or wrong thinking, or is it just one of those things that it depends on the manufacturer and depends on which Low-Temp sterilizer you're talking about?
Yeah, of course, there's going to be variables by manufacturer.
Sure, yeah.
If talking just about rigid endoscope, let's say there's a specific subset of bonding agents that most manufacturers will use for a variety of different reasons. One is we know that they withstand certain parameters in certain devices. We also know, and Jamie mentioned this in our earlier conversation that wasn't recorded, something about cleaning validations and studies. So it makes sense as a manufacturer to piggyback off of other test methods that have been proven to say, hey, this bonding agent works as far as sterilization efficacy and as far as product durability. So we might choose bonding agents from that perspective. When you talk about the comparison between autoclave and some of the other low temperature devices, without answering it definitively, I'll give you some things to think about. With an autoclave, your major concern is going to be the temperature and possibly the pressure. But again, the product is designed to be in that environment. Talk about anything other than autoclave, and I'm thinking as I say this, there are a variety of other chemistries that are used to either high-level disinfect or sterilize.
Right.
Okay. Does this mean that those devices are better or worse for the product? It's a great question, but it's a difficult one to solve because that's just one variable in the entire life cycle of a product.
Right.
Yeah. So I'm going to I'm going to hesitate. I'm a little hesitant to say, let's go this way. Cause if I make a statement, then I've got some companies that might think, hey, you're throwing stones at us, when in reality, you might say one is better for the patient, one's better for the product. And that's where, at least in my world, I'm trying to be that consultant in a way that doesn't jeopardize business for other manufacturers.
Yeah, well, that's why I felt comfortable enough putting you on the golf tee here, Kurt, and then throwing such a difficult question your way. I appreciate and respect your professionalism, and then also giving us some answers. I wanted to also circle back around to the adapter question. I'm thinking particularly of the light post adapters.
Yes.
Is there a science or a right and wrong with adapters, or a reason why IFUs might not agree with one another about what's the right way to sterilize the scope with those light post adapters?
Yeah,
well, you did some homework this time.
Well, you have to understand, I'm living in it. So
exactly. And I have the utmost respect for Jamie and her staff and everyone else around, North America and the rest of the world to answer that question. Whew. From my corporate perspective, anytime you have accessories that can be removed, they should be removed.
Great.
And I understand that's a challenge because, imagine you've got an instrument that has 10 different accessories that can be removed. And oh, by the way, we got to put it back together correctly. So now, our reprocessing folks do their due diligence. They separate it, reprocess it, sterilize it, high-level disinfect it, whatever they choose. Now it goes to the OR, and I'm not talking about clinic now, I'm talking about OR with a sterile container. Clinical staff opens up and goes, holy crap, what do I have in front of me? I've got pieces, and now I got to put this together. But ideally, that's what we'd want to do, because the why behind it. Obviously, if we have an adapter, a light post adapter specifically, we have threads, mating threads that meet as we rotate that assembly. Can the sterilizer get into those small crevices, avenues, if you will, to sterilize? I'm not that guy to ask that question. I don't know that answer. But what I can tell you is that we know if we remove the accessories and we sterilize it, we will get adequate sterilization efficacy. The drawback, so let's forget about efficacy. The drawback, and I've seen this over my career, I'm sure Jamie has as well, and Bobby, you probably have as well. If you leave those adapters on, how often have you tried to remove them? And it takes a pair of strong vice grips, channel locks, and sometimes, unfortunately, you end up pulling out illumination fibers and everything else that goes with it because something has migrated in between the threads and now has kind of, better word, baked itself in there, creating this locked up situation. The other is that frequently enough, it may trap something and it will affect the output of light. And a lot of times, if it's bad enough, the illumination or the light from the light source is actually going to deteriorate the bonding agent. It's going to deteriorate the illumination. What's going to happen is you'll get a yellow image on the screen. Clinically.
Interesting. Yeah, interesting.
Yeah. So you'll hear the term white balance. They're going to try and white balance the monitor to try and get colors to be correct. And it's just going to continuously be yellow, which is frustrating for the clinical team.
So I think patient care, right? We were talking about what can be within the threads and how to provide safe patient care. What about IUSS, that favorite word that all of us sterile processing folks love to hear? Just flash it. You mean IUSS? So what kind of drawbacks do we see there? I just feel like the IFUs are all over the place. Some might even say, oh, you can definitely do an IUSS on this, or absolutely not. Or they might not even say anything at all. And now you're left to guessing to figure out what goes in what. But then that also goes back to, it has to go into a steam sterilizer to IUSS as well. So now you're back to the low temp, steam sterilizing. But what about IUSS?
That's a good one. This is what I would consider. When we talk about a standard autoclave with its duration and time, and an IUSS device with its short amount of time for processing. And I know there's some caveats to all of that. From a manufacturing standpoint or a design standpoint, we're concerned about how quickly we've ramped that temperature up, to how quickly we've ramped it down. So let me give you an example. Conventional oven. When we turn it up, or when we turn it on to heat it up, it's going to slowly ramp up to a temperature. It'll expose whatever we're cooking to a certain period of time, whatever we choose, and then it slowly cools down. So it gives the optics inside of a rigid endoscope the opportunity to actually expand and contract. If we're using an immediate use sterilizer, then what happens is it's kind of like using a microwave. We hit a button, it immediately jumps up to a high temp. And then when it's off, it comes down and it doesn't have that cooling period. And, clinically, what typically happens is somebody grabs it out of there because they need it right away. It's really warm and they've got those big fireplace gloves, I jokingly call them, and into the OR. And just like a wine glass that, if we have a nice cold wine glass at home and we put it under hot water, and that's the end of the optics.
That's interesting. Now I know why my scopes come down broken. No, I'm just kidding.
That's right. Yeah.
In your opinion, where do you think the future is going? Like, where are we headed in our industry with these rigid, endoscopes as far as sterilization? Do you think it's going to be an or just this way and that's it? Like, where do you think we're going?
As a manufacturer, we're going to let the market dictate what they want. And when I say that, we have to think about it this way. So in your department, Jamie, you're reprocessing all telescopes, all specialties that minimally require either high-level disinfection or sterilization. As a company, we're trying to work with our customers to figure out, hey, do we want to high-level disinfect? Do we want to sterilize? Do we want to meet the requirements of our customers? Yes. Do we want to meet the requirements of governing bodies? Yes. With all that said, we're going to continue to validate what's most appropriate for what our customers are using. One thing that I'm finding interesting more recently than not is some customers are starting to ask, can we validate the use of manual high-level disinfection? Which is, I could
made a face. I made a face.
Yes, I feel exactly the same way. With that said, that kind of goes along the conversation we had earlier about oxidative chemistries and fixative chemistries. So some customers are doing the homework and they're realizing that they're going to get better performance in certain types of chemistries. And I think that's why they're choosing that path. That's not to say that's something that we would like to do as a company or other manufacturers would like to do as a company, but it's something to consider. Switching from autoclave or terminal sterilization, I call Low-Temp, or anything else that it's more than high-level disinfection. Trying to go the other way. They're trying to go backwards. Now, the other one I'm starting to hear more about is UV disinfection, which is interesting because there are some challenges with different types of materials on equipment. We're learning more and more about every day. While I think it's a great idea, it's going to be a challenge for manufacturers.
Yeah. That back and forth is always interesting when the market really wants something like these big these big flexible endoscopes, large diameter flexible endoscopes. Everybody wants those scopes to be sterilized. And so, but it's like, what's going to move first? Like you've got, regulatory that's got to move. The manufacturer's got to design something that can handle the sterilization. The sterilizer company has to innovate for cycles that can handle the long lumens and the weight of the thing. So yeah, lots of pieces to move in that direction, as we talk about innovation going forward. Well, Kurt, every one of these seasons, we always have one episode that leaves us sometimes with, more homework and more questions to do than what we started with. And I feel like that's how our conversation has gone today. And that's the sign of a good deep dive into a topic. So thanks for broadening our perspectives a bit today, answering some questions and posing some additional ones and helping us think critically about how to make wise decisions for sterilizing our endoscopes. I'm going to encourage everybody to, if you're not already, get connected with Kurt out there on LinkedIn. He's a great resource about rigid endoscopes and flexible endoscopes. And yeah, just a great person in the industry to get connected with. I'm so glad you said yes to our interview today, Kurt. Thanks for joining us again on the show.
My pleasure. My pleasure.
And that was Kurt Audette, clinical specialist at KARL STORZ, doing what he does best, breaking down rigid endoscopes for us and talking through not only how the things are made, but how those manufacturing decisions have a real impact on our reprocessing workflow of how the things ought to be sterilized, why you can put them in an IOSS cycle, and why you might pick one over the other. Jamie, I thought the discussion around sterilization methods was really interesting, because like I can see arguments from just about every direction for why an endoscope might get damaged in one particular method or another. Like with some of the low-temp chemistry, you can see how over time, even like colored flexible endoscopes like black ones start to turn gray over time just from the chemistry of it. So like our epoxies being damaged. I had never thought about the steam sterilizer depositing, water spots on the lenses of the scope, but like that's something to think about as well. So lots to consider when you're figuring out how to sterilize these endoscopes and the optics side.
It is, honestly, I didn't think about the water either, but it can happen because it happens even on our instrumentation. So that was good. That was something to definitely think about. I always err on the side of steam versus anything else, especially if an IFU calls out both of them. But then again, the low temp is faster, right? But yeah, you will see residuals of those chemicals that leach onto some of this instrumentation. I've seen it, and I've had to go back to vendors and show them examples of all this, and they scratch their heads too. So it's definitely an interesting topic, to try to figure out what's best.
Yeah. And it was funny thinking about IOSS as well in the conversation. We, at the facility that we were at, every now and then would have to turn over a scope really fast. And, IOSS we didn't want to do, but it would be a scope that we would have set up to go through steam sterilization. But you look at the IFU and sure enough, it could go through low temp. And so we would sometimes run it through our low temp sterilizer just because you don't have that cool down period.
Correct.
And you can get it back to the OR in
yes.
However 30 minutes or whatever that it would come out of the chamber. And I've seen that on some sterilizers. They have like a really rapid one where you're supposed to put just one endoscope in there and it can run a really brief cycle. So yeah, there's definitely advantages to the shorter time frame and turnaround to make sure that we're not having to do IUSS. So yeah, lots to think about from today's episode.
Definitely. The only advice, just read the IFU.
Yep. Read that IFU and follow up on some of the homework we had from
exactly.
today about looking at the exploded diagram of a rigid endoscope, and then Kurt's advice about the different types of chemistries. I've talked with Kurt about that some in the past, and it's an important conversation thinking about like the importance of having a clean device and how certain types of chemistries may interact with residue. So something to consider. But that's going to do it for today's episode. We'll be back with more SPD knowledge gaps in the weeks to come. But until we talk to you then, on behalf of Jamie, myself, and the whole team over here at Beyond Clean, keep fighting dirty.
Thank you for listening to this week's episode of Beyond Clean. As a reminder, you can help support us by subscribing to Beyond Clean on your favorite podcast app, or by downloading the smartphone app on iPhone or Android. Simply search for Beyond Clean in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@beyondclean.net. We look forward to hearing from you.